When I was 18, I got my first real job. With this job came health insurance. I'd never thought about health insurance before because I was always covered under my parents' policy. If I was sick or needed a prescription, I just simply went to the doctor. I never thought how much it cost for the insurance prescriptions or for the premiums. It was just something I always had. After I got married and had kids, I still didn't think very much about health insurance. I was lucky enough to have a job where I did not pay a single penny towards premiums. And if I went to the doctor, I only had to pay a $30 copay. That insurance also covered my husband and my children, once again not costing me a dime. All of my subsequent jobs have also offered health insurance. I would pay for that through weekly payroll deductions. So myself and my kids were always covered. It was something that was always needed, and it was something that I could afford. With the pending surgery in the next few weeks, insurance is now something that's in the forefront of my mind. I have insurance through my employer, but losing my job is a real possibility. If that were to occur, I would find myself in the position that many Americans currently find themselves in. I would have a pre-existing medical condition, I would have no income to pay insurance premiums with, and I would have children that need coverage as well. In the next few moments, I'd like to explain why health care is a major problem in our country, what the causes of the crisis are, and offer some solutions. Healthcare is a major problem in our country. Although Americans have the best trained doctors and best medical resources available through the healthcare system, the United States ranks poorly compared to other developed countries. According to the website HealthPack Online, a vision of quality health care for all, more than 47 million people in the United States are without insurance. 9 million of them are children. 40 million people last year did not get the medical treatment that they required because even if they were insured, they couldn't afford it. 8 of 10 of these uninsured people are from working families. Thousands of deaths each year are attributed to uninsured patients not getting the medical care that they need. In a 2009 article in the American Journal of Public Health titled Health Insurance and Mortality in the U.S. Adults by Andrew P. Wilper, MD, MPH, Steffi Woolhandle, MD, Karen E. Lasser, MD, MPH, Danny McCormick, MD, MPH, David H. Bohr, MD, and David U. Himmelstein, MD. They found a 40% increase in the risk of death for those who were lacking insurance. There are several reasons or causes that are responsible for the healthcare crisis in the United States. In the article, America's Healthcare Crisis, Is There a Solution by Robert R. Farrell, published in The Real Truth, a magazine restoring plain understanding, dated February 10, 2009, it states that in the last year, insurance premiums have nearly doubled, resulting in health insurance becoming unattainable for millions and putting families further into debt. The reasons for the high cost of care in the U.S. include factors such as rising costs of technology and prescription drugs and high administrative costs from the country's complex multiple payer system. Local emergency rooms are seeing an upswing in patients that they see because even if they're uninsured, emergency rooms have to treat you. In 2006, uninsured patients made up 1/5 of the 120 million emergency room visits that year. Employers are also dropping or eliminating health care coverage for their employees due to rising premiums, making it unaffordable. Of the 84% of Americans that are insured, 60% of them get their health insurance through their employer. There is a lifetime maximum benefits through insurance companies that many people with insurance aren't aware of. It's estimated that 20,000 to 25,000 people have reached those maximums and in turn have been dropped by their insurance companies. In 45 states, it's legal to discriminate against someone with a pre-existing medical condition when they try to purchase health insurance directly from insurance companies. The insurance companies can charge higher premiums, deny coverage, or refuse to pay for treatment for that particular medical condition. There are several actions that can be taken to solve this immense health care problem in the United States. One solution would be a single-payer system, much like they have in Canada, where one administrator, which would be a local government agency, would collect all the health fees as well as pay out any costs. So all Americans would be covered with medical benefits, and coverage would be based on a need base as opposed to who can afford to pay base. With this system, administrative costs would be greatly reduced by eliminating the tens of thousands of insurance companies in business. This is not the same as socialized medicine, where the government owns all the medical facilities and all of the providers are government workers. We would still utilize our current public and private sector healthcare system. Another solution would be the Affordable Care Act, which was signed into law in March of 2010. The Affordable Care Act is aimed primarily at decreasing the number of uninsured Americans and reducing the overall cost of health care. It provides a number of mechanisms such as mandate subsidies and tax credits to employees and individuals in order to increase the coverage rate. The Act puts individuals, families, and small businesses in charge of their own medical care. It reduces premium costs for millions of working families and small businesses by providing hundreds of billions of dollars in tax relief. The Act would promote prevention, wellness, and public health. It provides unprecedented funding commitment to these areas. The Affordable Care Act would also end lifetime maximums as well as eliminate the practice of discriminating against people with pre-existing conditions. Taxpayers would partially fund their health insurance through premiums that would be determined by their annual income and family size. I'm fortunate enough to have insurance right now. I've not fully followed the healthcare crisis in our country because, quite honestly, it never affected me. I never thought that health insurance would be something that I would have to worry about. I always had it through my employer, and I always thought it would be there. I never realized that donating a kidney would actually put me on a pre-existing condition list and jeopardize my insurability. I hope that listening to my speech, you see that there is a healthcare crisis in the United States. People are literally dying from not having insurance and not being able to afford it. This problem has several causes: the rise of insurance premiums, employers cutting back or eliminating benefits, and working families unable to afford insurance. There needs to be a change with our healthcare system because the system that we currently have does not work anymore. I think that the Affordable Care Act is a step in the right direction.